Hi, guys, and welcome back to the Rare Wellness Podcast, the podcast designed to help you heal holistically and give you the tools that you need to thrive. We're making it easy to understand medicine and wellness with practical steps from the experts, one podcast at a time. The only thing we ask is that if this episode helps you live a little bit more aligned and a little bit better, that you'll leave us a review and share this with a friend. That's all that we ask so that we can continue to provide you with free, valuable knowledge from the experts of well-being and help you to optimize your life. Today, I want to introduce our guest. It is a guest that we've had on before, and I really enjoyed our conversation, Dr. Grattan. He is double certified in pain management and physical medicine and rehabilitation. He has been practicing for over 15 years, and he just recently opened a branch for the Northwest Center of Regenerative Medicine in Vancouver, Washington, focused on regenerative medicine. So, of course, today's episode, that's what we're going to be talking about. Dr. Grattan, thank you so much for coming back on with me.
Well, thank you. It's a pleasure to be back.
Yeah, I'm really excited. We're going to continue our conversation on regenerative medicine. I know last episode we talked about the cost of traditional medicine versus some alternative therapies and the true cost of traditional healthcare. So if you guys haven't listened to it, be sure to go back. There was so much good things that we covered. But today, this episode is for those who really want to dive deep and into the latest research in regenerative medicine. So we've skimmed the surface before, but we're going to go deep into talking about the doses of platelets needed for good outcomes, repeated injections, advances in understanding pre and post injection care, and importance to getting good outcomes, latest muscle tear treatments, and so much more. So to start off, for those of our listeners who haven't heard much about regenerative medicine, could you give us a brief explanation, just like if you had to describe it to the average person on the street, what is regenerative medicine?
Sure. Well, in general, it's trying to boost your own body's ability to heal itself instead of an active sewing up or tearing out or removing areas or painful problems. Try to boost your own body's abilities to heal that. And so a lot of that comes from two or three main processes of spinning down and extracting platelets, which are the main initiator of healing in your body, and then spinning down your own stem cells from either fat or your bone marrow. And then others would be tricking your body with injected medications to try to mimic your own natural sources. There haven't been a lot of great discoveries or advancements in that final portion, but that is kind of the hope that we could just, reach for something off the shelf and inject it and get similar results to harvesting your own blood or bone marrow.
It's exciting. I mean, essentially what you're saying is that regenerative medicine allows you to be able to avoid some of those surgeries that you might have traditionally needed and keep your own body's parts instead.
Right. That's the main goal. And there's been a lot of good research that's been coming out in regards to preventing need for knee replacements, shoulder replacements, or repairing meniscal tears in the knee or rotator cuff tears in the shoulder or tears of the disc in the neck or the back instead of going through a surgery, just boosting your own body's ability to fix it.
Yeah, man, that's super exciting. So I know you recently went to a conference. Can you tell us a little bit about that?
Sure. It's called the Interventional Orthobiologics Foundation. And so the ortho being similar to like an orthopedic surgeon type treatments. And often were several surgeons there who are looking for, the latest research on avoiding the surgeries or treating and complementing the surgeries that they do. So that's the ortho part. And the biologics would be any type of substance that has a biologic effect, typically from your own body. Then foundation is just, the organization. So it's oftentimes called IOF. And that's one of the premier organizations that has conferences talking about the latest research, and members will, swap data and talk about the latest and greatest, and have various meetings throughout the year to kind of move forward the body of research.
Yeah. Was this your first time attending it?
Oh no, I think third or fourth. I
That's
go about
awesome.
every year.
Yeah. So, what were some of the things that you learned about this year? What's some of the latest research?
Yeah, and so there were, with the kind of research that's done, since this isn't, most of these treatments are not going to be easily gotten through FDA, because it's not really a drug.
Mhm.
And oftentimes the treatments are very customized for people's own specific condition or problem. So the location of injections are different, and so it's difficult to get a multi-center, multi-thousand patient trial where everybody does the exact same thing, processes the exact same way, and gets the exact same amount of platelets, because that's another big thing, is that not everybody has the same number of platelets floating around. People can have a fourfold difference. One person, if they have 100%, another person would have 25%. And there's no real symptoms between that. You just have to check the blood and kind of see where their platelets are, and then concentrate from there to hit some specific targets. So it's without the ability to really patent a drug per se. It's been very difficult to get large institutions like Pfizer or something like that to go through the difficult and very expensive FDA process. And so we're oftentimes left with individual clinics or universities doing studies on the realm of 20 to 100, sometimes 200 patients.
Today's podcast is brought to you by the Premium Center for Regenerative Medicine and Stem Cell Therapy in the Northwest, Northwest Center for Regenerative Medicine. Get back to the activities that you love without needing surgery. You can book your appointment at nwc4rm.com. Again, that's nwc4rm.com. This podcast is also brought to you by Rare Wellness Supplements. You can head over to rareplanethealth.com to get your supplements. My personal favorite is the premium fish oil filled with omega-3s. Again, you can go to rareplanethealth.com and get the supplements that you most need to support your health and wellness today. Lastly, this podcast is also brought to you by Rare Wellness. Rare Wellness is located on the South Hill in Spokane and is one center that provides all the wellness tools that you could need. Whether you're looking for a hands-on premium intimate yoga studio with a therapeutic emphasis, bar classes, Tai Chi classes, if you're looking for skincare treatments, injectable, hydrofacial, microneedling, organic spa treatments, if you're wanting to get therapeutic massage or book functional medicine appointments to get down to the root cause of your inflammation, Rare Wellness is the place for you. Whatever your wellness needs are, they have it covered. So to book your appointment today, go to rarewellness.com. Again, go to rarewellness.com and mention this podcast for 10% off when you're booking. Okay, time to get back to the episode. Well, yeah, I mean, especially, since you're using your own body to heal your own body, it's so individualized to each person that it would be hard to create a standardized observation. So, what did you learn about the dose of platelets needed for good outcomes in these treatments?
Yeah, so a lot of the research that's been done in the past had very poor controls as far as actually measuring the platelets at the end of the concentration period. And they would use a typical off the shelf system to spin down the platelets. And so in a lot of the studies, we could only kind of guess how many platelets that they actually were able to inject. By how much blood they drew. And so you're not going to draw, only 10 cc's of blood and have any significant number of platelets, even if you got every single last one in that 10 cc's. That's where a lot of the previous studies have shown there's fairly poor outcomes because every study tended to have pretty low concentrations. And recently they've been getting better controls, better specifics as far as the platelet dose that they've been providing. And the main breakpoint in the studies that they've found is about 5 billion platelets into a specific area to start the healing cascade.
So give us a perspective. 5 billion platelets. How much
Right.
blood, how much blood does that take? Like where?
So if you were doing just the knee joint, and let's say that your platelet count was in the blood 250, you would want to pull at least about 60 to 80 cc's of blood. Now, most of the time, when I treat a joint like the knee, I'm not just injecting into the fluid itself along the cartilage. And I'm an affiliate of Regenerative, and they've done quite a bit of longer term research as far as the importance of also injecting the tendons and ligaments that support the knee. So you then have stability, and you're not having issues where the cartilage may be less painful for a while, but because those ligaments aren't supporting or the muscles aren't supporting the joint very well, it's going to continue to wear out faster. So it's important to have both inside the joint itself in that fluid to help the cartilage, but also along the meniscus, along the joint, the ligaments along the sides that stabilize everything. And then some treatments into the muscles to try to encourage growth and healing of the muscles, because that's oftentimes what the main shock absorber is for the joint,
Right.
is the strength of the muscles. And then following that up with some physical therapy. So typically when I concentrate down, I am looking to collect 20 to 30 billion platelets to spread that throughout the area. So oftentimes the blood draws are 250, 300 cc's of blood. And then, that's correlated with much better outcomes.
Yeah.
And that's what the studies have shown. And you can go to the Regenerative.com webpage or my own webpage, NWC, the number 4RM, Northwest Center for Regenerative Medicine. And we have some outcome data on there that you can see the after an injection, the continued improvement even out for years. And that's latest research, and that's what this conference was talking about is 5 billion is fine, 8 is better, 10 is better. And so there really is a dose response.
Yeah.
If you say, well, Tylenols work for headaches, well, Tylenol didn't work for me because I took a quarter of a tablet. Well, that's,
Like, no, just to hit on. So I had some friends who, when I recently went in to get my labrum injected for regenerative medicine to avoid surgery, which, by the way, it has been feeling incredible. I'm about 3-4 weeks out and I'm feeling so stabilized, so much stronger. And I'm really excited to continue to see the results. But I had people, some friends and family members, when I was looking into it and choosing to go for regenerative medicine over surgery, who just had read some articles online and felt pretty skeptical about the whole experience. And I feel like what you're saying now makes so much sense, where some of those earlier studies that were done were not taking into account maybe like how many platelets were being injected or was it the right dose for the right patient. So yeah, I think that definitely has affected people's perception of this field.
Yeah, there was a large, what they call a meta-analysis, which is a statistician goes through and evaluates multiple different research studies and then collects them all together and tries to come up with a consensus. And that came out, I think, about a year or so ago, and suggested that PRP didn't work. but it's all about, garbage in, garbage out. And so if you go through each of those studies, uh, most of them had almost no controls as far as how much platelets. And so then we're kind of stuck with, how well the study is done, how well it actually recorded the platelets, and then what were the outcomes. So um, it can be frustrating. There's not a lot of incentive out there for the institutions to really seek out alternative treatments. So there's just not a lot of institutional dollars behind trying to study and make sure that this does work.
Well, and like we talked about in our previous episode, when you look at it, having solutions like this that could prevent surgeries for later on in your life, and even what you were saying about with some of these injections, it gets better over the years that are coming, and the research that you were hearing at the conference as well, that the benefits continues to grow for years to come. Versus with surgery, you get it done, and over time it only deteriorates, and eventually you're going to need another one. And let's talk about repeated injections. So you've had a treatment done, you've had injections done. Um, what did they have to say at the conference about repeated injections?
Yeah, that was interesting because going off of that idea of 5 to 8 billion at least, they also had some studies documenting repeated injections at 2 or 3 billion. And how did that work out? So someone had a total of 8 to 10 billion platelets eventually injected, but each time it was one of these low concentration machines. It wasn't fully concentrated like we do in a lab, and pretty poor outcomes. And so there really needs to be all in one wallop. Now, sometimes as we're aging, the body's always kind of wearing out, and so there may need to be repeat injections at some point. But it really needs to be all at once, that platelet amount. But yeah, the reasoning behind that is because the body needs to reach that threshold of enough signal from those platelets and their platelet-derived growth factor to actually bring those stem cells to the area. So hitting it multiple times at insufficient doses is wasting your time and money.
Mm. So for someone who is looking and interested in opting for regenerative medicine versus surgery, how do they know whether or not to trust a provider? Are there certain questions that they can ask them when they're consulting with them? How do you know if the lab is going to be able to spin to the high enough concentration?
Yeah, simply asking them if they do platelet counts and what would their normal, like, ask them how many platelets do you think we would need to inject in this area to get good results, and then also ask them how much blood are you going to draw. And if it's a big joint and that number is not triple digits, you might want to consider somewhere else. If it's the thumb, or the AC joint, or some little tiny area, then that could certainly be sufficient to treat a small joint. But a big one like the knee is going to need that 5 to 8 billion. And you can also ask them, what machine system that they use, and what concentrations they are typically seeing from that machine. Some of the more common machines, like the Harvest system, are getting 4 times concentration, and so you'd really need to inject quite a bit at 4 times in order to get that. And then you worry, well, is the joint actually able to hold that much fluid at that time? Are you spilling it out everywhere? And so that's the advantage of really getting it nice and compact, is you can put very precise amounts on those different structures. Anywhere that's, of course, a Regenix affiliate, that's one of the that is the premier regenerative procedure place out there. But this research into the importance of concentrations and dosing is out there for anybody to read that's a regenerative provider. So there's definitely consistency with Regenix, but we're not the sole arbiter of
Right.
who's doing a good job. Other people can do just as good a job if they put in the work.
Absolutely. So do your research when you're choosing who to trust. And I think this is whether you're doing regenerative medicine, alternative medicine, or traditional medicine. I just think it's important to be sure that you're asking the right questions
Mm-hmm.
when you're taking care of your body. So, what were some of the advances in understanding the pre and post injection care and its importance in getting good outcomes?
Um, yeah, so don't smoke. There's, the outcomes in smokers is very poor,
Is this
and
just nicotine or all smokers?
um, it's oftentimes just the smoking component as it increases the inflammatory levels and decreases the oxygen levels. Nicotine itself is a vasoconstrictor, and you're trying to increase blood flow to an area that heals. So there is some concern about nicotine itself. And I would strongly encourage someone to not be on any nicotine product. But if I can only get them down to just chewing gum and not smoking,
Mm-hmm.
I will take that. um, sleep, sleep is extremely important. We have a natural growth hormone and testosterone boost that happens when we get a full 8-9 hours of sleep, and that is working right in concert with your stem cells and platelet procedures. So those are the two big ones. Additionally, in the conference, they were talking about some add-on treatments, such as infrared red light therapy, which can superficially boost um, the release of the platelet-derived growth factor and increase vascularity. So I'm sorry, increase blood flow to the area. Not everybody's gonna know what vascular. I don't know. I keep talking all doctory. I need to stop that. um, and also, shockwave therapy
Yeah.
is a new and up and coming treatment, which is just kind of what it sounds like, sending little micro shockwaves into the tissue that's irritated and painful, both to provide that small amount of irritation that encourages healing, but it's also been shown to boost the mobility of the stem cells getting to the area and increase blood flow.
Yeah.
So those aren't required add-ons, but it's just an
For
interesting
optimization.
optimization of the areas that you're treating. Um, and in order of preference, sleep, no smoking, exercise, and maintaining that blood flow through exercise. And
Even
then,
after getting the injection.
yes,
Like you should stay moving that week or that. Yeah.
correct, gentle movements that week. And
Right.
then, depending on how bad your tear was or how bad the arthritis was, you'd really need to chat with your provider about what level of exercise, what type of exercise. Oftentimes, people will have good strength improvements without the risks by doing what's called isometric exercises.
Mhm.
Isometric is just a fancy word for not moving. So
Right.
holding positions, squatting in a little air chair up against the wall, pushing your arms against each other. So you're holding these positions, the muscles are tightening, but you're not really putting that shoulder or knee or hip through the motions that can be irritating or worsen tears. And so that's a very classic post procedure exercise where you're not worsening anything, but you are getting that blood pumping.
So, what is the latest in muscle tear treatments and regenerative medicine?
Yeah, so a couple people presented some really good papers on professional athletes who tore the muscle itself instead of the tendon or ligament.
Mm-hmm.
And then, like the classic would be, pulling a hammy or a hamstring tear. You hear that a fair amount. You can pull the muscles in, pectoralis tears are somewhat common. Tearing your lats, things like that in these sports where the muscle itself. So they've found that doing the platelet-rich plasma into those areas is actually not all that effective, and can potentially heal it up a little too quick, in my opinion, and lay down scar tissue as opposed to laying down muscle. And so they did a series on what's called platelet-poor plasma, where you just have the fluid after you've taken basically everything out, and injecting that into the muscle tears themselves. So it
Did you
still
say?
has. Go
Did you
ahead.
say platelet poor plasma?
Platelet-poor plasma. Yeah,
Wow. So it just doesn't have as many platelets. You're just
doesn't
injecting
have
the plasma. Okay.
just the plasma, but there's still the healing signals in that. And so without that platelet wall, which is what oftentimes starts the inflammation cascade, without that platelet wall, you kind of just have that fertilizer. And there were some studies that showed significantly earlier return to play in professional athletes relative to doing nothing or platelet-rich plasma. And so that was interesting because oftentimes the platelet-poor plasma you just kind of toss away because that's what we're trying to get rid of. And so now a lot of the Regenetics protocols are, doing the joints, doing the ligaments with the muscles, and then saving that platelet-poor plasma to inject the surrounding musculature to kind of give that a boost.
Up until this point, have there been alternative treatments for just those torn muscles, or have people mostly just had to wait around until they heal?
I had previously been doing PRP injections, and I have had some good outcomes in non-professional athletes. And it's a little bit of a very select group when you're a professional athlete and putting those muscles through the significant strains. And so healing up a normal tear in a weekend warrior, somebody who's really not, going crazy all the time. I've had, so that's been the classic. And I was actually quite surprised to see that although the PRP did improve relative to placebo, the platelet-poor plasma improved return to play much faster. And that was kind of the big exciting thing that I gathered from that. I was like, this is very different than the standard that we had thought the results were going to be.
It's always so exciting when you find out new information, especially when it's stuff that you had previously been, like you said, throwing away the platelet poor plasma. And now it's like, okay, there's a good use for this that we can use to optimize. So that's awesome. What else was at the conference? We've gone over so much really good material.
So the use in rotator cuff tears, shoulder problems, knee problems, that's very well documented. And when you look at the more recent, higher quality studies, it's basically confirmed at level 1 that it's recommended to do platelet-rich plasma for those things. The spine is kind of the area that hasn't been studied as much. One, because there's multiple different aspects of the spine. There's the facet joints, which are a common cause of localized pain. There's the nerves as they're coming out that can get pinched. That can cause pain shooting down the legs or arms. And then there's the disc itself that can tear and be a source of pain, or it can tear and push on the nerve. And so when you're talking about spine regenerative treatment, it's really kind of multifaceted. And in traditional medicine and research, you like to have one problem and one treatment, and then see if those work. But
Right.
when you've got, multiple problems, you have multiple potential treatment options. How can you, prove definitively the benefits? And so there were some studies kind of talking about just the multifaceted approach, where you're doing what's called platelet lysate along the nerves, which is where you actually break up the platelets and you release all the juice that's inside the platelets,
Ooh.
but filter out the platelet cells, the cell walls. Because remember, it's the cell walls that start that inflammatory cascade. So if you want to calm down the nerves and put the healing elements onto just the nerves, then you do the platelet lysate into the epidural space or along the nerve roots. And then platelet-rich plasma into the facet joints to help calm those. And then platelet-poor plasma into the little tiny multifidi muscles that help to stabilize the spine.
This
You
sounds
end
like
up with a whole bunch of
such a
injections.
complicated injection. I'm
Yeah, yeah. You only want someone like myself that's board certified in at least pain management. I'm also in physical medicine rehabilitation, so I've been doing 1,000 shots a year for the past 15 years, various types.
well,
So
I'm just
you
so
want somebody
grateful.
that does it a lot.
I was gonna say, I'm just so grateful that we have people who like yourself who study this, understand it, because it is just beyond me. Like I love learning and listening about all of it, and I'm so grateful that it exists. And when you're talking about just like how do you even separate the platelet wall? How do you have someone understand how to do that? Like truly, the human body is just so fascinating. And I just
Yeah,
the more I learn about it, the more excited I am that I live in a day and age where there's now options outside of just traditional surgery or
right.
corticosteroid injections. Like it's just so exciting. It's so
Yeah,
exciting to think about all of it.
yeah. And so they did some series with those treatments, and then saw the outcomes, and they had a significant improvement in nerve pain down the leg, mobility of the back, pain level overall. And then they had some really cool examples of the MRI changes where the discs looked healthier. And usually everybody's discs, they start to get black and desiccated, and then they squish, and
Mm-hmm.
then that's just, as you age. And I'm a good example of this. I initially got interested in regenerative medicine when I blew out my neck, C6-7, herniated over to the left with severe nerve compression of C7 nerve. And so my hand was going weak and numb. And like I said, I do injections. And
Yeah,
so
you
that
can't
wasn't
be having that with your career. Yeah.
right. So, yeah, I was going to have surgery, talk to some of my neurosurgeon friends, and I knew where this was going. But Dr. Lewis at Northwest Center Regenerative Medicine Spokane, he's a very good friend of mine. He was like, no, 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 come up. I'll fix you. I'll fix you. Well, he didn't promise he'd fix me, but he said, you got to try this first. And before I was in severe pain.
Well,
Arm strength's back.
truly,
Never had to have surgery.
it's so exciting. Like this is just all so exciting because no one likes to deal with pain. And when you're
Right.
dealing, whether it's your knee, whether it's your spine, whether it's your shoulder, like no one wants to deal with injuries. No one wants to deal with pain. And to know that there's possibility for you to return to
Right.
your optimal functioning is just like so exciting. Yeah.
Yeah. Now, as a caveat for people that do have a severe disc herniation, pushing on a nerve, it is very painful. um, and per the studies, surgery will get rid of that pain faster because you are directly offloading that nerve. And you need to decide whether you want to wait around for the regenerative procedure to work, or whether you want to go through the risks of surgery and have it done right away. And, it's worth a discussion because there certainly are some conditions that need surgery. If you're having problems controlling your bowel or bladder because the nerves are so pinched, that is surgery, because you need to physically offload that nerve right away, and you can't be waiting around for the regenerative products to work. Now, I was kind of on that borderline, you know. Uh, I'm very glad that I had the regenerative procedures, but if I didn't know that there was sunshine at the end of that rainbow, I might have opted for the quicker route.
Absolutely.
Because it was a month or so,
Yeah.
and a month or so for really good improvement. I mean, within a week, I was sleeping better and had less cramping and spasming down the arm. I didn't need to take as much gabapentin and whatnot. So I was, but yeah, it was a good month before I could sleep all through the night um, and was near where I should be. And then it's just continued to improve.
Today's podcast is brought to you by the Premium Center for Regenerative Medicine and Stem Cell Therapy in the Northwest Center for Regenerative Medicine. Get back to the activities that you love without needing surgery. You can book your appointment at nwc4rm.com. Again, that's nwc4rm.com. This podcast is also brought to you by Rare Wellness Supplements. You can head over to rareplanthealth.com to get your supplements. My personal favorite is the premium fish oil filled with omega-3s. Again, you can go to rareplanthealth.com and get the supplements that you most need to support your health and wellness today. Lastly, this podcast is also brought to you by Rare Wellness. Rare Wellness is located on the South Hill in Spokane and is one center that provides all the wellness tools that you could need. Whether you're looking for a hands-on premium intimate yoga studio with a therapeutic emphasis, bar classes, Tai Chi classes, if you're looking for skincare treatments, injectable, hydrofacial, microneedling, organic spa treatments, if you're wanting to get therapeutic massage or book functional medicine appointments to get down to the root cause of your inflammation, Rare Wellness is the place for you. Whatever your wellness needs are, they have it covered. So to book your appointment today, go to rarewellness.com. Again, go to rarewellness.com and mention this podcast for 10% off when you're booking. Okay, time to get back to the episode. Well, and I was just going to ask you this, but with most regenerative medicine injections that you do, I guess it's interesting because it's not like there's a day when you wake up and everything is better. Is it just like do some people experience that, or is it just a gradual, like how do you know, since you're constantly healing,
Right.
Is it just this like gradual improvement?
It's basically like a gradual improvement. If somebody sprained an ankle before and then it healed up after a month or so and it stopped hurting every time you walked, that's similar process. The problem is some people, sprain an ankle and they keep spraining it, and then the body stops really trying to heal it up. And then you need to kind of force the body by giving it those signals like, come on, heal this area up. Or the body can't heal it up like an arthritis where it's just worn out and it's just, not really putting forth the resources, because our bodies ultimately are very efficient. Our bodies want to use the smallest amount of calories, and we all know that because it's super easy to gain weight. It wants to use the smallest amount of calories and the smallest amount of resources to get us to the point where we can procreate, and then our body kind of stops really trying to heal itself. All of our growth hormone and testosterone levels drop. The stem cells start fading away and not being as active and mobile. So you have to counteract that complacency that the body has for efficiency's sake by either dumping stem cells straight on an area or dumping platelets to trigger those stem cells to go to the area. And you can kind of think of the difference, like platelets will oftentimes work in mild, sometimes moderate arthritis or early issues, partial tears where the tendon or the labrum is still intact, but it's just kind of peeled back a little bit and painful. If there's a gap, if it's completely torn, or if it's moderate to severe arthritis, then you need to dump some stem cells on that, because you need to make up, there's something that needs to go there in order to bridge that gap, if that makes sense. Unfortunately, those stem cell treatments are a fair amount more expensive and complicated. And you want to actually harvest those from your own body, as opposed to, there aren't any stem cell treatments that you can just inject off the shelf. If somebody is selling you like, oh, I got this stem cell mixture called an exosome, there are no living stem cells in that. They've shown that in basically every product that people have kind of brought up and said, whether it's cord blood, amniotic fluid, or placental tissue, by the time you get it, all those stem cells are dead, and it's someone else's. So
100%.
you got some, just use them.
Right. Your own body is your greatest source of medicine. And I think that, for everyone listening to the Real Wellness podcast, this is why we keep talking about regenerative medicine. And this is why it's super exciting, is because if you're here to optimize your life, your goal is to not just survive, but to thrive. Like, what better way? And we're all going to face deterioration in our bodies. We're all going to face injuries over the course of our life. What better alternative than to use your own body to heal your own body?
Yeah.
It's just perfect. So, yeah. Was there anything else that we wanted to go over, or?
Yeah. Some of the newer research, the up and coming research in people that have excessive flexibility and laxity, like Ehlers-Danlos syndrome, or people who've been in whiplash injuries, and then their neck wiggles around and pinches the nerves at the very tip top. That's kind of the next field, and using something called prolotherapy to try to tighten up the ligaments in Ehlers-Danlos, so people don't keep getting dislocations on accident. And then the whiplash injuries, I don't do any of the deep neck injection, but Dr. Centeno and company in Colorado are now doing ligament injections at the base of the skull coming through the mouth. And I'll leave that up to them.
Yeah.
But the outcomes are very exciting for a condition that has very little treatment options, other than they just fuse your neck to the top of to your skull. And that has all sorts of other problems. It's a big, dangerous surgery, and people oftentimes then have a lot of stiffness and pain because they're stuck. And so to go in there and to find those ligaments that are lax and treat the joints with stem cells and regenerative treatment is a real exciting route. And I believe the Centeno Schultz Clinic has an open clinical trial right now for that protocol that they've been doing.
That is extremely exciting. I know I'm going to do a little bit of my own or questions for myself. So I grew up extremely flexible, and like my hands, like I was always double jointed. So if I grabbed outside of the fact that I dislocated the shoulder last year, so I don't do it anymore, but I would always like be able to grab both hands and like just like
go up
pop,
and over.
up and over, like pop my shoulders in and out very easily. And I found that like even when I have torn certain ligaments in my body, like they would never be able to tell, because like my range of motion was always full, and like my joints have a tendency to dislocate. So for in the future, I guess a question is like for people who do dislocate easily, or if you are extremely flexible, like what would that look like for just the average person?
The treatment or the diagnosis?
Or is it something that I would have to treat? I guess I don't even know if I'll put this in the podcast. I'm just curious, like if it was something.
No, it's only a problem when it's a problem.
Okay.
So, like, are you able to touch your thumb to your?
Yeah. Well, yeah.
And then going backwards.
Oh
yeah. Okay. Yeah.
Sorry.
Yeah. So you have some level of Ehlers-Danlos, most likely. Have you had a genetic test?
Mm-mm. I did rhythmic gymnastics as a kid, so they would like put you on bars and like sit on you in the split. So I don't know how much of it was like genetic and how much of it was like trained.
Well, you can do it. Well, I don't know why they would ever twist your thumb back. It's
Yeah,
likely that you were a significant success in rhythmic gymnastics because of the laxity.
yeah.
But and the hard work. But yeah, I mean, you can do a 23andMe or something like that, and find out if you have any of the markers for mild Ehlers-Danlos.
And when is it a problem? I'm just curious. Sorry, now I'm
Yeah,
like,
it's a problem when you start having pain and discomfort in joints from repeated dislocations,
okay,
and it tears your labrum like it already has.
very nice. That was
So
it. I was just curious.
yeah, so you know where to go.
Yeah, exactly. Like, well, yeah, I don't know what you're talking about. Sorry, I feel like I interrupted you. So that's exciting that they just that they're doing those clinical trials, and that's huge for especially for people who haven't had treatment options up until this point. So,
Yeah,
yeah.
So the chronic headaches following a motor vehicle collision, feeling of looseness and instability in the top of the neck, and upper neck pain. There are very specific X-ray series that you can do to see if those ligaments were injured or are excessively loose. And I would give the Centeno Schultz Clinic a call there in Denver, and it would be worth a conversation and worth a flight out, because that's basically the only place that's doing that type of treatment.
Yeah.
It's the only place I would trust to do that type of
That
treatment.
type of treatment, absolutely. Yeah, it sounds very complicated. Like I said earlier, it's just Dr. Grattan, thank you so much for just helping educate us. Because like again, if you're here to optimize your life, you're into wellness, you want to do things the most natural way possible, there's just nothing more natural than using your own body to heal your own body. And it is so exciting to just explore and learn about what's new in the field and some of the up and coming discoveries and information. So thank you so much for taking your time and sharing all of this with us. If someone wants to book an appointment or a consultation with you, where can they find you? I know you mentioned it earlier, but can you give it to our listeners one more time?
Yeah, they can go to NWC, the number 4, rm.com. You can also find us on the Regenix.com webpage in Vancouver, Washington. Phone number is 564-444-8126. And you can set up, if you're not from around here, you can set up a telehealth, and then we can go over your scans and go over your problems and set up a time for you to fly in and out and get a treatment. If you are local, it makes it very easy. We're over by the Vancouver Mall, and just give us a call and you can set up an appointment.
Amazing. Well, thank you so much for coming on, Dr. Grattan. I really appreciated talking to you, and I know our listeners did as well. So, yeah.
Well, very nice to chat with you again. You have a good day.
Yeah. So, for everyone listening, be sure that you go to at Real Wellness Podcast on Instagram and send in your questions. Maybe even send in your questions specifically about regenerative medicine for Dr. Grattan, and we'll be able to ask next time that we have him on. So, just go on there, DM us. Everything stays anonymous. If this episode helped you learn a little bit more about your health, how to optimize your life, subscribe to the podcast wherever you listen to your podcast, and leave us a review and share us with a friend so that we can continue to provide you with free, valuable knowledge from the experts of well-being. Thank you guys so much for listening, and I'll see you guys next week on the podcast. Bye.
Well, take care.